I think this training is vitally important. What we know is that there's an awful lot more autistic people out there than are currently counted, recognised, identified. I do think language matters. We know that anecdotally there's plenty of evidence that autistic people are massively overrepresented in the use of mental health services, but that most of those people using those services are not formally diagnosed or even know they're autistic themselves. So having training like this will help those staff to better recognise who those patients and people might be. It will help them provide a better environment and a different therapeutic approach. This training should lead to happier, healthier lives for autistic people. And that might sound like a glib line, but we have some pretty tragic statistics and anecdotal and formal evidence on why this really matters. We know, sadly, the horrific figures on suicidality and self-harm among the autistic community. We also know that that directly correlates with being asked by society in general to constantly mask and camouflage who you are, your authentic self, your autistic self. And that means, unfortunately, that the very people we've been most likely to miss, because they've measured up against some kind of neurotypical ruler, have been labelled as mildly autistic, not a thing, or somehow doing just fine. But statistically, those very people have been the ones at greatest risk. So if we can adapt our therapeutic approach, learn to speak a little bit of autistic rather than constantly asking the autistic person to make all the change themselves, we'll remove some of that need to camouflage even in the therapeutic environment.